Hi, I'm Dr. Deborah Jeffries. Today I wanted to talk to you about so many things that are going on. As many people realize, we've dealt over the last year with all the challenges of COVID and what that meant to our healthcare systems, to our frontline providers, and frankly, to all of us. And now as we see that there are variants circulating in terms of currently the Delta variant and things that can really impact our lives in so many ways, it's important to think about what can we do from a virtual point of view to make it safer, easier, and so that we can more quickly respond whenever these variants and surges pop up. So the first thing I wanted to talk about was thinking about how you might use virtual patient registration in order to keep the patient safe and to be more efficient in how you're able to get in the information about the patient and their payers and all the stuff that's relevant to them. Secondly, with telehealth, you're able to bring in a virtual encounter over a video with a lightweight, easy to position cart that's going to make the difference between whether someone's seen safely or not and whether they get to see those experts that they need in a quick fashion. After that, you might have to look to things in terms of how do I do rounding and everything to make sure that I can get around all those patients as a remote provider in a safe manner, efficient manner. And for this, you can think about putting things like video conferencing rooms on wheels, where you're actually taking a cart from patient to patient and doing your rounding in a more efficient, safe fashion. So you're able to bring in more providers to help with that. Important aspect of this is being able to support virtual visits. When you have a loved one that's in the ICU and they're suffering and having problems with COVID, you want to make sure that you can get their family members in touch with them. You can do this by bringing in a easy to move, lightweight tablet cart and allow them to connect up with their family even though they can't physically get in there to see them. So at Tryten, we're trying to make sure that we're doing everything we can to help support you in your efforts to respond to surges in the virus and things that will help bring the patients the best possible care in the safest way and help you bring in like remote providers when you need them virtually so that you can tap into those resources to support the increased needs during a surge.